Hello, everyone, welcome back to our channel. Today, we're diving deep into a crucial part of our lives that we often don't pay enough attention to: sleep. More specifically, we'll uncover how sleep plays an instrumental role in shaping our mental health. Before we start, make sure to subscribe and hit the bell icon to stay up to date with our insightful content. Without further ado, let's shed light on the intricate dance between sleep and mental health. Part 1. Why sleep matters. Sleep. It's a natural process that every living creature needs. But why is sleep so vital? Well, during sleep, our bodies aren't just lying inactive. They're actively involved in a multitude of processes such as healing and repairing tissues, consolidating memories, and regulating hormones. Sleep is not just about rest, it's a form of restoration and preparation for the new day. Part 2. The deep connection between sleep and mental health. Sleep and mental health share an intricate and bidirectional relationship. Insufficient or poor quality sleep can contribute to mental health issues, and on the flip side, mental health disorders can also lead to disruptions in sleep. Consider this. Chronic sleep problems affect 50 to 80% of psychiatric patients, compared with 10 to 18% of adults in the general U.S. population. This link is too significant to ignore. Part 3. Sleep and specific mental health conditions. To delve deeper, let's examine specific mental health conditions. People suffering from insomnia are 10 times more likely to develop depression compared to those who sleep well. Also, disturbances in sleep often go hand in hand with more severe manifestations of anxiety and depressive disorders. Sleep problems don't just impact mood disorders, they are a recognized risk factor in the development and recurrence of bipolar disorder. Other conditions like attention deficit hyperactivity disorder, ADHD, schizophrenia, and even post-traumatic stress disorder, PTSD, are significantly influenced by our sleep patterns. Part 4. Strategies for enhancing sleep to boost mental health. With this strong link established between sleep and mental health, it becomes evident that improving our sleep patterns can lead to better mental health outcomes. So, what can we do to enhance our sleep? First, establish a regular sleep schedule. Go to bed and wake up at the same time every day. Make your sleep environment conducive to rest, dark, quiet, and cool. Develop a relaxing pre-sleep routine, like reading a book or listening to calming music. Learn to manage your stress through practices like meditation, yoga, or journaling. Stay physically active during the day as it can help you fall asleep faster and enjoy deeper sleep. Part 5. Recognizing when to seek professional help. Sometimes, despite our best efforts, sleep problems persist. If you're grappling with chronic sleep disturbances or if you find that poor sleep is adversely affecting your mental health and daily life, it's crucial to seek professional help. Remember, sleep disorders are treatable, and rectifying them can lead to significant improvements in your overall health, well-being, and quality of life. In conclusion, sleep is not merely a passive activity or a luxury, it's a fundamental requirement for our mental, emotional, and physical health. As we explored today, it's evident how intertwined sleep is with our mental health, affecting and being affected by various mental health conditions. If you've been taking sleep for granted, perhaps it's time to give it the importance it deserves in your self-care regimen. As always, I hope this video brought you some valuable insights. If you found it helpful, please like it, share it with someone who might benefit from this information, and don't forget to subscribe for more content on psychology, mental health, and self-care. We have a lot more enlightening topics to discuss in the future. Until our next video, prioritize your sleep, look after yourself and others, keep fostering a curiosity to learn, and always make your mental health a priority. Goodbye for now, and I'll see you soon in our next discussion.